Welcome to the 2025 Small Research Grant Announcement. I am Sue Haddock, Sigma Foundation for Nursing Board Chair, and on behalf of the board, I thank you for your donations and for joining us today. Your donations to the Foundation's Research Permanent Fund make possible all the grants that are awarded annually to nurse researchers around the world. We received more than 90 grant applications from 6 global regions for last December's research grant deadline, and will be funding 15 small grants to researchers in 3 global regions this June. Today, we have 5 of the recipients with us to give you an overview of their study that will be conducted over the coming year. I am pleased to first introduce to you Dr. Jing Liu of NYU Grossman School of Medicine in the United States, whose study is entitled Barriers and Facilitators to Access Breast Cancer Care in Underserved Chinese Americans. Dr. Liu.
Good morning, everyone. Thank you, Sue. Thank you all for having me today. My name is Jing Liu, and I am a postdoctoral research fellow at the NYU Grossman School of Medicine. I am also a proud member of the Sigma Theta Tau International Honor Society of Nursing and the recipient of a 2025 Sigma Nursing Small Research Grant. First, I would like to express my sincere appreciations to the committee, reviewers, staff, and of course, our generous donor. Your support is not only advancing my career as a nursing researcher, but also helping to address an important health equity issue. With this grant, I will be conducting a qualitative study focused on the barriers and facilitators to accessing breast cancer care in Chinese American women. This group is experiencing the fastest growth in breast cancer incidence in the Asian American in the United States, yet they remain underrepresented in the research and underserved in care. And these women face unique health disparities. They are less likely to have their physical discomfort addressed after the diagnosis and often don't know whether or where to seek help for emotional challenges. Even though their survival rate is high, many experience the long-term pain and emotional strugglings during the survivorship. Unfortunately, many studies still group all the Asian Americans together, overlooking the distinct needs of subgroups like the Chinese American. To address this, I will lead a focus group with around 30 Chinese American breast cancer survivors to ask them questions about what helped them to access breast cancer care, what didn't, and what they need most. The goal is to inform culturally tailored patient-centered care that the nurse and other providers can use. Importantly, these projects will help serve as a foundation for my future TAE award applications, where I plan to design an intervention to improve access to breast cancer care for this population. As a nurse, a researcher, and a member of the Chinese American community, I am deeply committed to making sure that these voices are heard and their needs are met. This project aligns well with the Sigma Nursing's mission to advance health equity, as well as the United Nations Sustainable Development Goal of ensuring the universal health coverage for all people. I believe this work will contribute to more equitable cancer care, not only for Chinese American women, but also for all the underserved groups. Thank you very much.
Thank you, Dr. Liu. Joining us next is Dr. Yim-Hua Mak of Hong Kong Polytechnic University, whose mixed method study is Effect and Feasibility of Dyadic-Based Acceptance and Commitment Therapy to Manage Thirst Among Patients with Heart Failure. Dr. Mak.
Hello. Thank you, Sue. And also I would like to thanks for the Sigma's Small Project Fund to make our proposal study, to be able to implement. I am Yim-Hua Mak from the Hong Kong Polytechnic University. I'm so excited to share our research project titled Effects and Feasibility of Dyadic-Based Acceptance Commitment Therapy to Manage Thirst among patients with heart failure, and this is a mixed method study. Firstly, the chronic heart failure patient often experience significant thirst, exacerbated by the strict fluid intake restriction. However, non-compliance with the fluid restriction can lead to severe complications such as cardiogenic edema, and can lead to poor prognosis and also even mortality. So we actually recognize the critical role of the family caregivers in providing emotional support and enhancing adherence to this food restriction. In our previous study, we conduct a dietetic approach, acceptance commitment therapy for helping this group of the patients in terms of their tackling with the psychological distress and also enhancing quality of life. But we didn't have the opportunity to tackle in the food restriction and the thirst symptom. So for this study, we aim at using the primary aim of this study is to improve the thirst management, overall well-being for both the heart failure patient and their family caregivers through a series of 4 sections of dietetic acceptance commitment therapy. This is a therapeutic approach focused on fostering acceptance of the uncomfortable thoughts and feelings related to thirst, rather than avoidance to the symptoms. So by addressing the thirst and food restriction, we hope to reduce the emotional distress and also promote open communication between the patients and the family caregivers. Our study employed a mixed method study design, utilizing a concurrent triangulation approach to assess the quantitative data and also qualitative data. So the instrument, including some of the validated questionnaire, like the first intensity approach, the visibility and also the satisfactory among the participants of the study will be also focused as well. So the qualitative insights will be conducted by using semi-structured interview to capture the experience of and the perspectives of the participants' diets. So the qualitative data will be enrich our understanding of how the dietetic acceptance commitment therapy impacts on their lives. So this is the overall design of our study. Thank you very much.
Thank you, Dr. Mack. Next with us is Dr. Jude Omenyi at the University of Suffolk in the United Kingdom, whose funded study is exploring social prescribing processes in nurse-led weight management clinics, facilitating engagement in physical activity and weight loss among minority ethnic women with excess weight. Dr. Omenyi?
Right, afternoon. This is afternoon in the UK, so probably fair to say that. I am Jade Omenyi. I'm one of the assistant professors here in the School of Nursing, Midwifery and Public Health here at the University of Suffolk, England. I'm really pleased to be here. It's an honor to have received this grant. I appreciate Sigma, and I also appreciate all the donors. Thank you very much. With this grant, I lead a team of researchers that work on largely managing weight and encouraging and facilitating physical engagement broadly, not just amongst women, but also amongst the adult population. And for this project, I am looking at expanding that project. It's part of a wider project. So the overall aim is to co-produce a sort of culturally sensitive mechanisms to facilitate an engagement with social prescribing, specifically for weight management, but also, if you like, physical activity amongst ethnic minority women. So the county and the region that we are here is somehow located very close to the coastal line, a mixture of the coastal area, but also rural area, and then the city as well. So there seems to be some sort of difficulties around accessing services for women, especially obviously mixture of family caregiving responsibilities. And this project is at the back end of the fact that there is a huge a figure around obesity, particularly amongst the ethnic minority women. We know what happened during COVID, the back end of COVID, where there were a lot of social prescribing in that regard. So we had a preliminary project which we've completed about 2-3 years ago, which indicates that social prescribing does have something to offer in terms of facilitating engagement for physical activity and weight loss programs in the community. And therefore, what we seek to be able to do is to work with an existing physical activity, but also weight management clinic here in the community. And they also have nurses as well that lead those clinics. So we are aiming to work with them and recruiting these individuals from this particular ethnic background to then co-produce what we think would work for them, because there are existing activities, existing services, but of course that don't seem to work for them. And so what we seek to do is to co-produce that. But specifically, we will be interviewing them. We will be running a series of focus groups activity, but also quantitatively, we will deploy some weighing scale. We need to get their height and weight to be able to calculate the BMI, because we're seeking to be able to measure the outcome in terms of when we do produce the intervention. We need to be able to test that to be able to measure that it's working, or if it's not working, we'll also know where to make adjustment. So in terms of the design, it's going to be a mixed method design, but largely qualitative. In terms of the participant, these are going to be coming from existing weight loss program, but then we're going to be working with nurses in the general practice settings here in the community, because obviously that's where they are being referred largely from to this weight loss clinic. So that's what we're going to be doing. But really, the overall outcome that we are seeking to be able to produce is to produce a culturally sensitive, tailored, if you like, mechanisms for facilitating engagement with weight loss and physical activity via social prescribing, and to be able to broadly, in the long run, develop some sort of scalable, if you like, intervention that may be able to that may be used nationally, or if you like, internationally, to help reduce the disproportionate impact of obesity, which is increasing broadly, if you like, inequalities amongst the population. And we think that this aligns with the Sigma research priority, which aims to level up all of these inequalities. So thank you for this. Thanks for your time, and thanks for listening to me. Thank you.
Well, and thank you, Dr. Ominyi. Joining us next from Florida Atlantic University in the United States is Dr. Narcisco Quidley Rodriguez, whose study is Companion Animals and LGBTQ+ Veterans, Exploring the Benefits and Risks of Furry Animals.
Thank you all for allowing me to be here. I've been a member of Sigma Theta Tau International since 2014, when I got my nursing license. This project for me represents a culmination of my interests and life experiences. So first, my father is a Vietnam veteran, and growing up, I witnessed firsthand the impact that mental illnesses like PTSD can have on our veterans population. I would see my father resort to alcohol use to cope with some of the issues he was experiencing due to his service. Additionally, however, there was always pets in my household growing up, and I lived with dogs and birds my entire childhood. And when I saw my father interacting with these animals, I could see his demeanor change. He seemed more calm and at ease when he was petting and playing with our animals. And then lastly, I am a member of the LGBTQ community, and I'm very aware of all the health disparities that members of this community experience. As a mental health nurse, I continue to witness those disparities among LGBTQ people in the hospitals experiencing depression, anxiety, suicidal ideation. So much of my previous research has really focused on addressing those health disparities among that population. When I was hired at FAU, one of the teams there is a CPAW, which stands for Canines Providing Assistance to Wounded Warriors, headed by Dr. Kraus-Perello. And the mission of CPAW is to comprehensively advance research, education, and practice protocols for our wounded warriors and veterans, really through the development of evidence-based and restorative interventions to support military families as well, not just veterans. We do work with adolescents of military parents. And so with this, I'm really hoping to explore something that hasn't been explored. We have research on companion animals in the LGBT community. We have research on companion animals and veterans, but we do not have any research, nursing or any other discipline, on the impact companion animals can have on LGBTQ veterans. So my project is going to go ahead and explore physical, emotional, psychological, and financial benefits, as well as drawbacks of living with a companion animal among LGBTQ members, of veterans specifically. After completing this project, I'm really hoping to triangulate that data with a quantitative results as well. So I have submitted another grant to another organization to really pursue that quantitative aspect of the study. And additionally, with CPAW, we're working on a PCORI grant to try and help get shelter animals adopted and into to live with veterans, and where we provide training for the animal and really allow that veteran to pick the animal that they think best suits their needs. So this project and the impact it has on veterans is only possible through the generous donations of all of you and your support. So I want to personally thank each and every one of you for helping me start this project, and I will uphold Sigma Theta Tau's mission with honor. So thank you.
So thank you, Dr. Rodriguez. The last grant recipient with us today is Priscilla Rodriguez, and she is from the University of Washington in the United States. Her multi-method study is Insights into Hispanic Family Caregivers' Sleep. Dr. Rodriguez.
Thank you. Good morning. It's truly an honor to be here with you. I want to express my gratitude to the Sigma Foundation for Nursing and its generous donors. Your commitment to advancing nursing is a truly invaluable support, especially for scholars like me who have limited access to funding opportunities. I'm deeply thankful for your support. This grant will have a profound impact on my research with centers on Hispanic family caregivers and their sleep health. This often overlooked group faces a unique challenge. Many of individuals do not self-identify as caregivers, as they consider these tasks to be intrinsic to their role as parent or children. This perspective often led to delays in seeking necessary support and resources. Currently, in the United States, an estimated 8 million Hispanic family caregivers provide care for a relative. Available evidence for caregiver studies show that a staggering 76% report experiencing significant sleep disturbances, with insomnia being the most common and disrupted issue. Chronic insomnia is strongly associated with numerous adverse health outcomes. And despite this evidence, there remains a significant gap in understanding of Hispanic family caregivers' sleep outcomes. My work aims to close this gap by examining the intersection of social determinants of health, caregiving responsibilities, and the unique stressors associated to the immigrant experience and the impact on sleep health. I propose a multi-method approach to gather and comprehensively analyze Hispanic family caregivers' sleep outcomes and explore the influence of cultural perspectives and beliefs related to sleep. My long-term goal is to develop a culturally meaningful intervention that can improve health and quality of life for this vital segment of our society. Finally, I want to take a moment to acknowledge the dedicated mentorship of Dr. Johnny Kahash, a fellow Sigma grant recipient, whose guidance has been instrumental in my PhD journey. Also, thank you for your time and for your ongoing commitment to supporting research that uplifts all communities. Thank you.
And thank you, and thank all of you for presenting information about your projects today. As everyone can see, there are a variety of projects here that certainly will help us as we inform health caregivers in the future to better care for people around the world. So Sigma looks forward to the annual Research Congress in Seattle, Washington, that will be this summer. It's home of your university, Dr. Rodriguez, and we hope everyone is planning on attending. Visit Sigma's website for details. If you have questions for the grant recipients, please put them in the chat. And while you do that, I am pleased to introduce to you Sigma's president, Dr. Sandra Bibb.
Thank you so much. And thank you, everyone. Can you hear me okay?
Yes.
Can you hear anything else besides me? I'm okay, that's great. You know, this is one of my favorite Sigma events. What I need to tell you is that I say that about all Sigma events. So, but for now, I want you to know how impressed I am with everything that you have presented in the brief synopsis, and I will say very well done, of your projects and getting in a small period of time. I always like to associate myself with the wonderful work that you're doing. And so I just made some notes as you were talking that I'd like to share with you to convince you that I'm associated with all of your projects. The first set of notes I made were about the 15 grants being given in 3 regions, and represented here, I believe, is Asia region, the European region, and North American region. And so I congratulate you all for being representative. I hope you understand that term, represent, for this biennium of what's happened in this award period. And then I start with Dr. Lee. Is it Lee or Lou? Okay, Lou. You know, my dissertation work was on my big area is population health, but I did access to care and health disparities in African-American women. So I was particularly interested in what you're exploring and what you're doing. And I made an awful lot of notes in that regard. And then we moved to Dr. Mack. And my association with your work is I served on a dissertation committee for someone who was looking at heart failure. And I learned a lot about that field. So I commend you on your persistence in helping us add to the knowledge base in that realm. Then we moved to the name that I'm going to really mispronounce, Dr. Omniyi. Thank you so much for your work. And population health is my area, my major area of research. And even though I could place all of the work under population health, I think this exploration into weight management and physical activity and everything in terms of focusing on areas that aren't always funded, aren't always well funded. So I appreciate that. And then we moved to the first Dr. Rodriguez, Whitley Rodriguez. I'm a veteran, a 30-year veteran, and I was on active duty at the time of the Vietnam War. I have a ribbon. I served stateside, but I commend you for your persistence in this area. And then lastly, we come back to population health, and multi-methods, which I'm interested in. So I hope I convinced you that I hear, I understand, and I celebrate you. And I also celebrate and thank the donors, because without them, this work would not be possible. And I'm so grateful that Sigma has this capability to provide small grants to help get a research trajectory started, or to provide base funding for higher goals. And I celebrate you for being part of a Sigma legacy, because you now have received a Sigma grant. Thank you all so much.
Thank you, Sandra. Are there questions that have come up from our participants?
Renee Bridges saying that Dr. Liu's work makes her think of the work from ANA with the Commission to Dismantle Racism. And she thanks Dr. Liu for doing that work.
All of your research is so interesting and so needed. Like Sandra said, a number of us have interests in similar areas, and I have a daughter who's a veteran. My husband was a veteran. So I truly appreciate, and I retired as the director of research at a VA hospital. So really glad to see some nursing research coming forward there. And I just really want to thank our 2025 small research grant recipients again for joining us, and wish them continued success throughout their career. I also thank the foundation donors on the call and ask that you please continue to donate annually so important nursing research like this is supported. Next year marks the 90th anniversary of the first nursing research grant given by Sigma. Please share what you heard today with your colleagues and encourage them to donate to nursing research at Sigma Foundation for Nursing to support the work of nurse researchers around the world. Thank you again, and we'll see you next time we have grants to announce.